Okay, here's number counter. 1, 2, 3, 4, 5, 6, 7.
Testing. It's Tacey's time of topics. A time for Tacey to discuss topics of the day. Skål!
Hey.
Oh yeah, I'm here. Lydia must be here.
Lydia here?
Yeah, I think she just arrived. How are you?
Good. How are you? Just playing some circuit tracks for the people in the waiting room, the Fluid family in the waiting room.
Love it. I said we won't make it too brutal. What is today? The 20...
I can fuck with it. 27th.
8.
8? Oh,
Yep. 8.
damn it. Yeah, I will. I'll put this on the show notes.
Got it.
Let's see how I can remember how to do that. Okay.
Is anybody with us yet?
Yeah.
Cool.
Yep. There's quite a few in there actually, and
Yeah, you've already got us rolling, baby. I like it. Come on, Mr.
yeah, Akron Rockstar has COVID.
Oh, man.
No, and then Johnny Longfellow's wife has got it for the 4th time. I said we just need to quit testing for it.
Yeah, we really do.
Test for it in people who have symptoms and are at risk, because we can treat them. There's no point in testing for an endemic virus anymore, unless there's something you can do about it.
¿Por qué ustedes hablan español?
Sí, es verdad. Tu español es muy malo.
Mi también. Yo tengo mucho malas palabras. Solamente.
It's really, you just know bad words.
Exactly. Oh, shit, we were tighten up. Mom's here.
Yay! Liddy-da.
Hey, Lydia, what's up? She made it.
Okay, I'll make sure your link is for the rinse is on the show notes
Cool, man.
this time.
Thank you. Me gusta orinar. Hey, Woody Haney, what's up? Hey, Woody. ¿Qué anda, güey? Does feel good, doesn't it? How are you?
Turn your mic up.
Cool, man.
Oh, what do you got?
Oh, that's beautiful. Well, thank you, Lee.
Okay.
I haven't been it. Oh, wait, I have been that good.
I'm
this
all
week.
about extracting refugees, even if I.
You've got a good place to put this jacket, that Moog Fest jacket.
Oh yeah, I got my Mogfest jacket.
God, you can't mess with a Moog Fest jacket.
I do have a.
What's wrong with you, Taste? How could you?
Microphone's on.
Blasphemy! I say blasphemy.
No, that's okay. Try it.
Hello, hello. Yep.
There you go. That is not a good angle for you. I need to find a.
For me.
Yeah, no, it's just because it's looking sort of tangentially.
Should I say it like this?
No. Oh, yeah, I mean, we're not doing it for the camera.
We
I'm
had
just-
red. What were they calling him last week? Red balloon head.
Oh yeah, Stacy sat there.
Oh my
and
God, his head looked like it was like.
It did. It looks monstrous.
He looked like he wore a size 12 hat.
It looked like he was going to explode, like the the teacher from South Park. Okay, that guy, and he wears his tie too tight. His head is
Yeah.
a big
That was
temple.
him.
I remember that. Mr.
Mr.
Shit,
Something or
what's
other.
his
I can't
name?
remember his name.
Definitely had a name.
Oh my! Woody must be going to his
Yeah,
bad joke bag.
it's between a lentil and a chickpea.
You never let a lentil on your face.
Well,
Was that
that's
joke?
close.
That's close.
Oh.
He said I never had a lentil on me.
Well, I saw a meme about the other one.
Yeah.
Last week.
We should probably tell that joke. That's a pretty good one. I did have the AI tell Carl jokes. I thought maybe we could do that.
Oh man.
Let's see.
See, are Velcro so they could go on like a suitcase.
Yeah, there's the sticky back and then they're Velcro inside, so you can pop it off and stick it on something if you want
He
to.
loves to put stuff on his
I love it.
suitcase.
That's really cute.
Cute.
Awesome. It's awesome.
I think so. I think it's a good looking patch.
It is. It's a beautiful patch.
It's called Patch Ops. The guy's a little bit crazy. The company that makes them Patch Ops.
Oh yeah.
But they do a great job. Crazy in like a cool way, you know. Very outspoken,
Oh, really?
unapologetic.
Well, I would. Could we get a weird medicine patch?
Yeah.
Or does he just do political stuff?
No. He would do that.
Man.
Huh.
Okay, you guys ready?
I love it.
How much those cost?
Yes.
Those look expensive.
So I ordered
Dude.
200 and it was at $260 a piece. So it's a little bit less. If you order 100, it would be like, closer to $4 or $5.
Yeah. Okay. So you.
Yeah.
Okay. Never mind. I mean, I don't need 100 weird medicine patches. That's the thing.
Well, I'll get a quote
Okay.
for like 50.
20.
Oh, okay. Yeah. I didn't know if you would
10.
sell them on
No,
Amazon.
nobody wants to buy my stupid shit. But we can use it as
definitely get
promotional materials for live events.
Mhm.
All right, you guys ready?
Yep.
Yes.
Okay. All right. Oh, well, I'm not ready. How about that?
Googling one last thing.
Tacey, do you have topics?
Yes.
Okay.
And I've got the one you sent me.
Well, I don't remember what I sent you, so it'll be
Period
fun.
poops. Yeah.
Oh, yay.
Oh, cool.
Period poops.
Yeah.
Yay. Okay, well, we'll do that one too. I don't remember sending it. Okay, here we go.
It's time for Weird Medicine with Dr. Steve.
got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valve, exacerbating my physical woes. I want to take my brain out and blast it with the wave, an ultrasonic, echographic, and a pulsating shave. I want a magic pill for all my ailments, the health equivalent to Citizen Kane. And if I don't get it now in the tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease, so I bathe it.
It's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio and the longest running show on this channel. I'm Dr. Steve with my little pal, Dr. Scott, the traditional Chinese medicine provider who gives me street cred with the whack alternative medicine assholes. Hello, Dr. Scott.
Hey, Dr. Steve.
And we've got my partner in all things, Tacey. Hello, Tacey.
Hello.
And back from sabbatical, it's P.A. Lydia, everyone. Hello, P.A. Lydia.
Hey, y'all.
Yay, this is a show for people who had never listened to a medical show on the radio. If you have a question you're embarrassed to take to your regular medical provider, if you can't find an answer anywhere else, give us a call at 347-766-4323. That's 347.
Pooh head.
Visit our website at drsteve.com for podcasts, medical news, and stuff you can buy. I can't mention contractually. Most importantly, we are not your medical providers. Take everything you hear with a grain of salt. Don't act on anything you hear on this show without talking it over with your doctor, nurse practitioner, physician assistant, pharmacist, chiropractor, acupuncturist, yoga master, physical therapist, or whatever. And don't forget to check out Dr. Scott's website at simplyherbals.net. Simplyherbals.net. And I will say this, Dr. Scott, and this is not an advertisement because we can't really advertise, but your CBD nasal spray is the bomb. That is the best thing you've ever done.
Thank you.
It's in the right delivery system. Finally, I know you must have said something to whoever made it. That my old pal, Dr. Steve, wasn't as thrilled with the old delivery system. This one's perfect.
Thank you.
So I'm just wondering if anybody's reached out. Have you sent? Because you always send some stupid tchotchke or something when you send something out to one of our listeners.
I
right?
do always.
So have you sent out anything lately?
Oh, yeah. We
For-
sent a
to
few
our people?
Actually, we sent, I think we had 3 Weird Medicine
Three?
orders this week, which is good.
Ooh.
That's
That's
good,
cool.
though. No, that's good. I'll take it. Hey, listen, 3.
Oh,
It's a hell of a lot better than 0.
well, true.
And most of them order more than one thing, too.
Okay.
They'll pick up a couple of the sprays or a fatigue.
Well, anyway, it's
Anyway.
yes, it's not an ad.
No,
but,
no, not that.
But still,
But
I
appreciative.
have to say that.
But appreciative.
Yeah, check out Dr. Scott's website. It's simplyherbals.net. You really you hit a home run with this one, my friend. I'm just going to tell you that right now.
you go.
And I get nothing from that. We get nothing from that. So
And you'll like it.
yeah, that's right. And I'll just keep bending over and taking it up the rear end, and I'll like it.
Thank you, sir. May I have another?
So yeah, very good. We have a couple of topics, and then we got a million questions. So this is gonna be very
Let's
question
just
heavy.
jump in.
Okay,
do it.
we'll do it. So
Let's go, Tacey.
here we go.
It's
All
Tacey's
right.
time of topics. A time for Tacey to discuss topics of the day. Not to be confused with Topic Time with Harrison Young, which is copyrighted by Harrison Young and Area 58 Public Access. And now, here's Tacey.
Hello, everyone.
Hello, Tacey.
I know the show just started, but if you forgot to go pee, now would be a good time.
Oh, really? Why?
Oh, yes. Well, because I have 3. It was another slow health week, if you will.
Okay. Well, that's okay.
What does that mean?
It would be just as funny if I played that and you just said, I don't really have anything.
Well, I'm sure that's going to come at some point. And maybe next week. So the first little story I have is about how an IUD ends up in a woman's bladder.
Oh,
The symptom was blood in her urine.
okay.
She had gotten it a decade earlier, and it had eroded through her uterus into the bladder.
Holy moly.
IUDs can last up to 12 years, which I had no idea. The perforation
Well, you forget about it.
happens. How could you? I mean,
I can tell you some stories about it. We're going to, as a matter of fact, talk later about a story about someone who forgot something
Oh, okay.
like that.
Well, the perforation
And
happens.
it wasn't anywhere close to 10 years.
Is this Tacey topic time or is this Steve?
Right.
topic?
Well, this is Steve's
Teaser.
show. So Steve
Steve
comments.
teasers.
Steve comments on Tacey's topics.
Perforation
And
happens
titties.
in 1 in 1,000 women. And they found a bladder stone, pulverized it, and removed the device. So that is my first little story.
Wow, that was a good one. So if you
Sounds bad.
have not had your IUD checked in a while, you should have it checked. And the thing that is disturbing about that is this patient probably should have been getting pap smears.
That's right.
And go at least at the interval that they recommend.
Okay.
Some people are every 3 years now, but still, if that thing was going on for that long, I'll bet you that she was not having routine medical care.
No, I agree. So the second boring story that I have is a man had a 4-inch piece of cement in his heart after a spinal procedure. He was 56, chest pain, difficulty breathing. He went to the ER. This was in the New England Journal of Medicine.
Okay.
The spinal procedure was done to treat a vertebral compression fracture. It's
Okay.
called kyphoplasty.
Kyphoplasty, yes. So
Yes.
this is what happens if you think of your spinal column as a bunch of blocks of balsa wood, and they're on top of each other with some sort of gel between each one, and so it makes it flexible. And if you have compression in the axial direction, in other words, pushing down on the spine, the spinal column, you can actually crunch one of those vertebrae. Usually it's because you could have a tumor there, or you could just have osteoporosis, or you could have some terrible trauma. And when it does that, the pieces move around and it causes horrible pain. And one of the treatments they can do is to actually stick a needle in there and put
Like a concrete.
epoxy.
Yeah, like concrete.
Yeah, it's like concrete, but it's epoxy resin, and they put it in, and under pressure and it has to be under pressure because there's a lot of resistance in there. It will lift back up and reform the vertebral body, in theory.
Yes. Not
And
perfectly,
so
but
that's
in
what a
theory.
kyphoplasty is. And then, after that's done for a lot of people, they have complete resolution of their pain. They get full function again. Apparently not in this case. It sounds like somebody might have pushed the needle in a little bit too far.
Yeah, it says a rare side effect is that the cement can leak from the bone into other areas, causing a blockage or embolism of a blood vessel.
Yeah.
So,
I see. So
Doctors removed the cement and repaired the tear in his heart.
holy moly. Does it say what part of the heart it was in? Because if it was in the right side of the heart, then that would have been a vein that that they injected cement into a vein and then it traveled into the heart. Did it say? It's okay if you don't know.
So, yeah, I do not know because I wrote this down.
Oh, you did.
Yeah, so I do
Wow,
not. I
she's
do
been
not.
doing
Several
I tell you
paragraphs.
what,
She abstracts this shit and
listen.
actually does.
Listen,
Hell.
since she's retired.
bill.
Yes,
If it got injected into an artery, it would have been traveling away from the heart, right?
Correct.
So it would have to be a vein.
It's got to be a vein,
Yeah.
or they injected it directly into the
Into it,
heart.
yeah.
That was
Or
what I
in-
was thinking.
yeah.
because if it was
it's right-
T7,
your-
T8,
Your
right
heart
straight through.
Your heart
Yeah.
is right there.
They shouldn't make the needle that long.
And they have the needle, and the guy's going, oh, and they go, and it's like, oh, okay, maybe I should back that up a little bit.
It's kind of, maybe about the time the neurosurgeon was putting in there had a sneeze or a achoo.
Yeah. Yeah. And then the scrub tech said,
Well, that's because you're an idiot.
But that stuff is kind of like
Sure
you were
they
saying.
didn't say
No, I don't. But don't you? That stuff is kind of hard to control as far as where it goes. And
yeah,
to
no,
a certain degree,
you
yeah.
are doing things without being able to directly visualize it. One of the things that they taught us when I was a medical student, I remember having to do a rigid sigmoidoscopy on a homeless person that had rectal bleeding and they were unconscious. That we couldn't get consent. I mean, it was bad, but it was an emergency, so we had to do. And of course, in an emergency, get the fourth-year medical student to do it. But we did a rigid sigmoidoscopy, which we don't really do anymore. It's a metal tube just to look and see if you can see where the bleeding is coming from. And they always said, don't ever advance this thing except under direct visualization. In other words, you got to be looking through it and then advance it, because if you just shove it in, you could perforate somebody's bowel. You could even still do it if you do it under direct visualization, but at least it reduces. But under, in a situation like this, there's no direct visualization. Now, you might be able to use X-rays to watch what you're doing at the time, but even then you're seeing a 2D projection of a 3D image, so it's very difficult. And did they say what the incidence of this is by any chance? No. That's okay.
I mean, it probably did in the article.
Okay,
It
fair enough.
just says rare
Yeah.
side effect.
Okay, rare. We'll take that as 1 in a jillion, I hope.
Yes, you
It's a procedure I may need someday.
So the last little story that I have is that a woman's pet cat gave her cowpox.
What?
Doctors feared she would lose her vision. She took a bunch of antibiotics, but it didn't work. They were trying to figure out what it was. This was also in the New England Journal of Medicine.
Yeah, good.
The patient's pet cat had developed unusual lesions on its paws and head, so I guess they put the two together. The cowpox can affect cows, cats, and humans. It's very rare to get it from a cat. The woman received treatment with tecovirimat
Okay.
that doctors
I'll give
got
you-
from the U.S.
a bill.
Damn it! Come on, man!
Suck it.
I'm 2 down already.
That doctors got from the U.S. Strategic National Stockpile, kept in case of a bioterror attack with smallpox.
Yeah, and that's something.
Jeez
It
Louise.
cleared her infection.
It is a cousin of smallpox.
Wow.
That's what Salk noticed. Was it Salk? Jesus, it was Salk, right? He noticed that milkmaids were not getting smallpox. They'd be in the same house as everybody else. So you know, a lot of people, they all live together in these houses, and you would have your servants or whatever living in there, and the smallpox had swept through the house, but the women who were working with the cows weren't getting it.
Wow.
And then he put 2 and 2 together. They had gotten cowpox. So one of the things he did was started inoculating people with cowpox just to see if it would protect them. And in fact, it did. It was the first vaccine. And because cowpox doesn't kill you like smallpox does, but it is closely related to it. Isn't that crazy?
That is crazy.
So, anyway,
I didn't know you
say,
could still get it. Had this woman been vaccinated for smallpox? Surely not.
It didn't say that, and it did not say how the cat got it.
Okay, she hadn't been. She was 28. They don't vaccinate for smallpox anymore because it's gone.
How in the world did that cat get it?
Well, apparently it's not that uncommon in cats. It's
Wow.
uncommon for humans to get it.
Wow.
Yeah, samples from the cat's lesions and the woman eye both tested positive for orthopox virus. Isn't that something?
I thought it was cool that they got it from the Strategic National Stockpile.
Hell yeah.
That's pretty cool.
Yeah,
Did you know we have one?
monkeypox is also related to orthopox viruses too. Yeah, well, we have to, because the thing is, when we eradicated, and when I say we, the human species eradicated smallpox, they kept some of it in vials in different places around the world. Now you would say, why would you do that? Well, you kind of hate to render something extinct, and then it kind of goes against some scientific thinking that you just destroy it so we never have access to it again. Now, I think at this point, now that we can sequence DNA, you just sequence its DNA, you keep that in a database somewhere, and just kill the fucking viruses that we have in these stockpiles.
And you can always make it again.
You can just make it if you need it for research purposes or whatever.
Yeah.
But the last thing we need, now that we don't vaccinate for smallpox anymore, is someone just releasing smallpox back in. We have to do this all over again. So it's fucking viruses.
So that's it with Tacey's.
That was
topic.
awesome. I'm going to give
was
you
good.
another
Give
yourself a bill.
That's 2, Scott. Why don't you just...
That was 3.
I got
Tacey's
3?
time
I
of
didn't even
topics.
notice one.
A time for Tacey to
Suck it.
discuss
I'm
topics.
getting crushed here. I'm getting crushed.
All right, now, do we have
Crushed.
Lydia's time of topics? Hang on.
It's Tacey's time of topics.
Wait, let me try that again. Wait a minute.
It's
Lydia's.
time of topics. A time
Anyway, what do you got?
Oh, so in sticking with our IUD theme, we also have another woman's topic
Excellent.
for the ladies in the room.
All
Excellent.
4 of them that listen.
For all 4 ladies who listen, and it's certainly something that I have learned today. I was today years old, right? I don't ever say this word really, except for talking with my 2-year-old, but period poops. Poops being the
You say
operative
period
word.
poops to your 2-year-old?
I say poops,
Oh, okay, the poop part. Okay.
not period poops.
Now, mommy's having a period poop.
So, Tacey, if you think back, so there's a tendency for women to have more bowel movements, more frequent bowel movements, or even report diarrhea whilst menstruating.
That is true.
It is true,
Really?
right?
Yes.
It is true.
Did you just tell Tacey, did you say if you remember back, how do you know she doesn't have periods anymore? Are you accusing her of being
No,
postmenopausal?
I just meant
Menopausal?
like through your history of having your last.
Listen, I'm
Month.
taking this wonderful birth control, and I do not have them. And thank God, praise God. So
I've tried that. It does not work for me.
Really?
Yeah.
this is one for
and-
old people.
Oh,
It wouldn't be for you.
maybe in 5 years. So, yeah. So there's science behind it. That reason. Go
Okay.
figure. Okay. So two chemicals. One of them is a hormone that we all know called progesterone.
Yes.
Which helps to maintain a healthy pregnancy.
Delightful.
It also is slightly constipating. And so when you're on active menstruation, the level of progesterone decreases.
Yes.
So therefore you kind of stop that constipating approach. And the second is more active, and that's the release of prostaglandins from the uterus. So prostaglandins are fatty acids that, from the uterine perspective, help us to contract our uterus during delivery.
Sexy
They
stuff.
they can give you, IV prostaglandins, to help with contraction. It also causes, the period cramps, the shedding of the uterus. But it can also, prostaglandins also have a role in bowel contractility and bowel contraction. So
Can you please stop bullshitting?
is it?
No, you're
He's
Sound
just,
like bullshit?
He's just
No, no.
totally.
Can you
fucking
Yeah.
please stop bullshitting and
He's
get to the
playing with
question?
buttons.
I'm just pushing buttons.
Anyway, so you increase your contractions via the prostaglandins,
Yes.
of your colon. So
Okay.
more
That's
frequent
awesome.
period poops, guys.
That's a good one.
yourself a bill.
So,
You should give yourself one.
please go ahead.
No.
Well, I was
you
going to say,
don't.
so is that why constipation is more common prior to? Right?
That's
It
true.
could be.
That's
You
also
get the
true,
progesterone
Scott.
surge.
Yeah, I would think so.
Yeah.
Yeah. Because that's certainly something we see
Yeah,
a
so
lot.
that's one of the signals
Yeah.
is when you have a pregnancy brewing in your uterus is one of the signals that the placenta, the nascent placenta will put out is a progesterone analog. And that, so one of the ways that the body knows there's no pregnancy in there is when the progesterone level falls. So, and then it's like, oh, man, I guess we got to slough this lining off and try all over
Right
again.
on.
Try again next month.
Isn't that wild?
Yep.
Yeah. So anyway,
Interesting. Speaking of women who listen, there are 2 women who listen. They are Jen and Carol from the podcast Mom Swipes Left. And they have submitted some questions to us.
Okay.
And what I hope they will do in the future is because we have, when you guys do women's health stuff, the guys, are actually some, may be interested in it, but we do get a lot of emails saying, thank God you guys finally did something for us. And when we first started, the show was primarily just dudes because Opie and Anthony's audience was mostly dudes.
Penises.
Yeah, penises, nuts, dick cheese, stuff between your toes. Women don't ever have stuff between their toes
Dick
because
cheese.
they clean themselves off. I mean, they're hygienic. But anyway, apparently we do have more women listening now. So these are questions from Jen and Carol, and I'd like to maybe we'll do a little bit with them where they record a question and ask. But anyway, the first question is, do all animals masturbate? So not really a women's health question, but that's okay. It's they're cool women, so they're asking a cool question. And I had to go to my AI model. So I'm working with an AI model, and it's called GPT-3, not to be confused with Chat GPT. And this is one that I've tweaked a little bit to answer medical questions and help me in my job. And so I asked it, serious question, because if you don't preface it with that, it will say, this is inappropriate.
Oh, really?
Oh, yeah. I said, what animals other than humans are known to masturbate? It said, studies have shown that a variety of animals, including primates, dolphins, and elephants, are known to engage in self-stimulation or masturbation. Then I said, can you elaborate? This is for my radio show, just because I'm big timing the AI, right? And so yes, sure. Primates such as chimpanzees, bonobos, and gorillas have been observed touching their own genitals for pleasure. Dolphins have been observed using their fins to rub against their own bodies and the bodies of other dolphins. Elephants have been seen using their trunks to rub their genitals. What? Can you imagine being able to beat yourself off with your nose? How awesome would that be? Why aren't they doing that all the time? What's wrong with them? Additionally, cats, dogs, and it's probably sand because they got sand all everywhere. Additionally, cats, dogs, and other mammals have been observed engaging in self-stimulation. So that was a good answer from GPT-3. And I used to have a dog that if I threw my coat on the floor, he would just start humping it.
Oh, goodness.
Cosmo would do that with his little stuffed kitty cat. Do you remember that?
Oh, yeah. He would just bone it all day and all night.
For some reason, this brings up the time that we were at Busch
you
Gardens
don't bring up that time when I did that. What you're going to talk about?
in Tampa, and we watched the monkeys eat their poop
That was the greatest
for an
thing.
hour, and the boys thought that was just. I mean,
So there was a group of chimpanzees, and they were just standing around, and this one puts his hand behind his ass and shits in his hand, right?
No.
And he's looking at it, and the other ones are poking at it and like, what do you got there? What do you got? What do you got? And he's like, look what I did. And they're poking at it. And then didn't one of them like stick their finger in their mouth after they poked on it?
they were
and
eating
stuff?
it,
Yeah, they ate
and the
it.
boys.
was like,
I
"Here,
mean, they were like, how old?
I
were
made
they?
appetizers.
How
Have
funny.
some.
They were teeny.
Oh my gosh.
They still remember that. It's burned in their
It's
brain.
traumatic. Yeah.
Dramatic in a good
In a
way.
good way. Oh, my
That is
goodness.
pretty good.
Well, I did.
Well, what else have they got to do?
Um,
There's nothing else to do there,
Well, I don't have a lot to do, but that's not something that I.
I'd find a tree to swing
Eat
from or
shit
something.
and
Yeah.
Yeah, but you've swung on all the trees. You've known that. You've been there. You're in a zoo.
Take a nap, baby.
You
Thanks,
finally have
girl.
something that you've never seen before in that place is this fresh turd. I remember when I was, before I was potty trained, I remember this like it was yesterday. And I was still in my crib, and we were still living in a house that I know we had to. I was really little, so I didn't like do this when I was 6. If I was 15 months maybe,
Okay.
and I remember kind of pulling myself up in my crib and shitting in my crib, and I thought it was very creative. It was like, wow, look at that. And I know that I didn't have words then, but I remember thinking, that lady that takes care of me, mom, is going to be really happy with me. And I was very surprised when she came in and she was like, what the hell is this? And, said bad baby or whatever it was that she said to me. I was very disappointed.
Wow.
That's my earliest memory. And it couldn't have been 15, 16 months of age. Anyway.
Starting to see
That
some
did
trends,
remind
taste.
me, not to go off on too much of a tangent, but there's the coffee that's produced from poop of animals.
Yes.
Yeah. Okay. Tell me
Yeah.
about that. I've heard
So,
about this.
yeah, the coffee is called civet coffee or Kopi Luwak. And
Kopi
so,
Luwak.
well, Luwak.
Don't
How
you
would
dare
guys
look that
pronounce
up and order that for me.
Yeah.
Don't you dare do
Consists
it.
of,
Don't
like
you
a
dare do it.
Because I order her coffee, and if it comes in little Keurig things, I'm ordering.
Yeah.
Don't you dare.
It
How'd you like that
consists of
coffee taste?
partially digested coffee cherries, which have been eaten and defecated or pooped by the Asian palm civet, which is a little animal, little rodent-like animal. Looks like a rat, actually.
I mean,
What's the name of it again?
Kopi Luwak
I drink
or civet
I
coffee.
drink kombucha. I mean, it's like I can't really say anything about that.
Anyway, just reminded me of that.
Yeah,
Maybe they're doing something more exotic there, those apes.
I like that.
We have a point. Maybe they're
Kopi Luwak.
maybe they're eating something and pooping it out
Better
for,
not.
to start breaking down the protective shell or something.
Maybe. All right. Speaking of the AI, I was going to show you one other thing if I can find it. Oh, damn it! What did I do with it? Well, never mind. I got the AI to do some roast jokes for Carl. We'll do it next time. I did post it on our subreddit, and it was. I just wanted to see if it could be funny. Oh, here we go. So you have to train the AI first, right? So I said, "Can you write roast jokes?" And it said, "Sure." What did the coffee say to the tea?
Oh,
you,
no
you
way.
Look, you look a little steep. And it's like, no. I said, no. That not roast coffee. Roast jokes are written for comedy. Roast, where friends get up and make fun of each other. For example, then I gave it an example, one from the Creep Off roast. I said, Vinny's so lazy. When he got COVID-19, his nose didn't run either. So I told it that one. I said,
good one.
Can you write me a few jokes like that? Edgy, even mean, and then you have to say it's all part of the fun, or it'll say I can't do things that are going to harm people. So it came up with for Carl. I said, can you write jokes about our friend Carl Hamburger, who has come, he's known to have crooked teeth, although I think he's very pleasant looking myself. But it says, Carl's teeth look like a zipper. They never quite seem to close all the way. That's not bad for an AI.
It isn't bad.
And then I said, could you get a little bit edgier? And I gave it an example. And I said, you always know when it's bedtime when Carl puts toothpaste on a jigsaw. And I said something in that vein. And it came up with, if Carl had $1 for every crooked tooth, he could buy a straight one. I thought that one wasn't bad. That's pretty good. I'll have to give it that. So,
God.
jokes by AI.
Laughing at a robot.
All right. I know. It's crazy.
Hilarious.
All right.
Number one thing, don't take advice from some asshole on the radio.
All right, here we go. Let's take some questions. Let's quit messing.
Hello,
around.
Dr. Steve.
Hello.
How are you?
Oh, good. Very good. Thank
Good.
you.
Good to hear. Hello, Dr. Scott. How are you?
Good as well.
Good. Good to hear. Dr. Steve, I have a question for you.
Oh, he didn't ask you to if you're
Oh,
okay.
no, Taysom.
Now,
That's fine.
who whispered Cardiff Electric? Because I want to know who did that. Very good. Very
I'm
good.
learning.
Yep, I'm gonna,
Give yourself a bill.
that's
Oh,
exactly
for
who that
God's
is.
sake.
Hey, you roll your eyes, buddy. But I'm a
But this
noob.
is a great question, though. And this is from like
As you may know,
this is like back in April. So
I occasionally dabble in the use of edible cannabis products.
I did not know that.
Also, as you may know, I have a very luscious masculine beard.
Okay.
Occasionally, while grooming,
Can I take a
I will
nap?
shave my beard. At this time, sometimes I can get the faint smell of marijuana
There you go.
from the beard.
How'd that happen?
As I said, I only consume inedible forms like gummies or chocolate.
Can you please stop bullshitting?
That's more appropriate.
So why does my beard smell like marijuana?
Okay. Jesus, dude. So I looked this up. It made sense to me. Marijuana is fat soluble, and so it is stored in fat cells, and the skin has lots of fat cells in it, and also secretes oil. And I looked up a 2017 article showed that cannabis can indeed, if it's taken orally, be secreted in oil and sebum glands of the skin. And if you've got a big, you want to smell Scott's hair? Smell Scott's hair.
On my beard.
See if you can smell any marijuana on him because he only uses edibles.
I only use edibles.
But if you have a big old beard, if you have a big long beard, it's got much longer time to have more cannabis like molecules secreted onto those hairs as they grow, and it's right under your nose. And when you cut it, you may actually get a whiff of pot because the nose is extremely sensitive, and that is a very distinctive smell. I mean, when you smell it, you know what you're smelling.
Even the first time you smell it, you're like,
Yeah,
that's
pot.
what marijuana smells like.
Yeah. All right.
So is that why they'll do? Because there's an alternative to the drug testing.
A follicle testing. We've pulled that. We did this on a guy. He would always say, "Well, let me say I heard about this." This guy that would always say, "Well, I can't pee," and so they'd say, "Well, okay, we'll schedule you to come in for a follicle test, and we'll get a hair follicle." And so the next time he came in, he'd shaved his head, right? And he was like, "Ha ha ha!" And then the investigator just reached over and plucked a hair out of his arm and went, "Okay, no problem," and stuck it in there. So all right. Anyway, so yes, that is a distinct possibility. Thank you, Mr. Cardiff, for your phone call. Let's see here.
Hey, Dr. Steve. This is John from Chicago.
Hey, John.
Question about tinnitus, or tinnitus, whatever.
Yeah. Nobody knows how to pronounce it.
I think I get tinnitus every now and then. That's just really the kind of the random ringing in the ears, right? But it can be worse for some and others, right? For me, it seems to come on and off every now and then. It's random. It's just something. I'll move my head and then I have that like long piercing ringing in the ears. That's tinnitus, right? So I guess if you could answer that question, I'd appreciate that.
Yeah, absolutely.
Speaking of tinnitus, what is there a worrisome aspect of the ringing, or is it just an annoyance to the person who's experiencing it?
Right.
Like, is it a sign of degrading, ear functionality or something like that? I know you're, I think, a fan of that Children of the Men movie, and there's that scene where Julianne Moore says every time that ringing happens, there's like one, type of tone or decibel that you'll no longer hear it. I was like, is that?
No,
that's Googling, that sounded like bullshit, but I don't know. Does it mean anything when that ringing happened? Is it kind of like, hey, you'll never hear that specific tone again? Anyway,
right.
Appreciate it. Love the show. Talk to you later.
Yeah, that's not true. And they, if you remember, that character said a lot of stupid shit in that movie. But it's a great movie, by the way. Children of Men, highly recommended. Benign paroxysmal vertigo can cause tinnitus, but he didn't say he gets dizzy. Mm-hmm. But there are people who have positional tinnitus or tinnitus. We were always taught it was tinnitus. And if there was an I at the end, it would be tinnitus, except that we also have pruritus is spelled with the U.S., so there's no rhyme or reason to it. So it's fine either way. But tinnitus is just a ringing or sound. It could be static. It could be even music, because sometimes the brain will interpret this static or random sounds as music, and people say, I'm hearing old swing music or something, because that's in their head. And it never stops. It can drive you bonkers. So you want to see an ear, nose, and throat provider for that. And the reason I say that is this could be just crystals in your inner ear that are moving around when you move your head, causing some ringing in your ears. But there also is a condition where you get a thing called dehiscence of one of the semicircular canals, and it can cause a positional tinnitus as well. And what that means is it's just breaking apart. And you would need to go to like a microsurgery center to get that fixed. Not saying that's what it is. That would be unbelievably rare. But I'm just saying this isn't something. Don't just blow it off and go, well, weird medicine said it's probably just, benign. I just want you to get it checked.
Yeah.
So go see an ear, nose, and throat. Show them the position that you have to assume to create the tinnitus. They'll do a hearing test. They'll try to reproduce it in there. They may do some imaging just to make sure that you're okay. And if it's just sludge in your inner ear that's causing it, then okay. Then they'll give you some exercises, one called the Epley maneuver, just to get that sludge in a place where it doesn't cause problems.
Did he say what position he was in?
I don't think he
yeah,
did.
that's kind of interesting, though, isn't it?
Yeah, it is interesting.
So you also think about like a loud noise exposure, right? Like veterans who have been
Sure.
exposed to loud noises.
But it's there all
often
the
report
time.
it more. Yes, it'd be there all the time.
Well,
yeah.
but
now it
depending-
wouldn't be positional. So I guess what I'm saying.
Yeah. Because I was going to say, and that's what I was asking. A lot of times a lot of people will have the tinnitus with position, but it's at bedtime because there's no sound, so
Yes.
it seems relatively louder.
It seems like it's
Yeah,
when
it's
they're
yeah.
lying
Yeah,
down,
yeah.
but it's actually So you got to ask those context questions too.
Yeah, and plus it could have been medication and caused.
Platinum.
Could be
I ask
medications,
patients,
antibiotics. Could be loud noises.
Now, when you just use some jargon, when certain chemotherapy
Yeah,
agents,
certain
what you're saying.
chemos, yeah.
Yeah.
Okay.
Damaged nerves.
Yep. All righty. Very good question.
Good one.
Hey, Dr. Steve. I was wondering, I know I had heard a episode earlier that you said that you answered this on your first show, which I can't find anywhere.
That's okay.
But
join the Patreon.
What makes it so that when you ejaculate, the ejaculation comes out very slow and dark colored? It almost like it doesn't want to come out.
Yeah. That's a great question. Very common.
If you could answer that for me, I'd be appreciated.
Absolutely, man. And yes, that is a question that's come up very often. I think it was on our very first Sirius XM show that this came up. And a lot of times when you have yellowish, thick semen that has like chunks of looks like tapioca pearls in it, what that is seminogellin. There's a protein in semen that causes semen to gel. But you don't want it to gel in the seminal vesicles. You want it to gel afterward. So it's like what's supposed to happen is it's almost like one of those epoxy cements where you mix two things together and then you let it sit and then it turns into epoxy, right? Or that's what we know. And so there are components of this protein that aren't supposed to activate it until it actually hits the air. And so and the purpose of it is when you ejaculate, we often forget that the reason, we forget the point of, thank you, go fuck yourself. But we forget the point of intercourse.
Whose point?
Is to impregnate, for the man to actually impregnate a human female. That was what it was designed for, right? And
allegedly,
we forget that. We just have intercourse with whatever orifice and whoever, but we kind of that aspect of it slips our mind a lot. And so the reason for semen to gel is because when you ejaculate into a vagina, you don't want the woman to stand up and run away like they probably did in the caveman days, because there's a saber-toothed tiger coming, or God knows what kind of consent they had back then. But you don't want the semen to just flow back out of the vagina. You want it to gel and stay there so that the sperm cells that are inside it can work their way up and try to find an egg in the right place, right? And so that's what that protein seminogellin is for. And but if you leave this fluid inside the seminal vesicles long enough, it will gel there. And then when you ejaculate, you'll ejaculate sort of this jelly-like semen that's, nobody's looking at it really. So unless you're Are they?
You wouldn't want to have it chunky, right? Like,
Chunk
the
style.
partner,
You don't like
the
chunk
partner
style?
might
I'm
not
gonna-
appreciate
She's a
it.
smooth and creamy kind of gal, not a chunky kind of gal.
So, okay, so you would see it when, I guess, when you're giving someone oral treats, I guess, and you're not swallowing, right? I mean, that's when else would you see
Or
it?
you would like sense it if you were
Yeah,
swallowing it.
I guess. Yeah,
Yeah.
I don't know how tactile it is. I mean, it looks, I mean, it's thicker. Yeah, that's true. It
So
wouldn't
then,
be like.
then is the treatment for that or to overcome that ejaculate more?
Yes,
Yeah.
yes.
Okay.
Yes.
How about dehydration? Cha cha cha.
Yes. That too. There you go.
Give yourself a bill.
So
One.
fluids. You're the only one that's counting, dude.
Oh, good for
Yes, I know.
you.
That's okay though.
Good for you, buddy.
Fluids.
That doesn't seem very sincere.
And frequent ejaculation.
Okay.
All right. Which is why mine is like concrete, but that's a whole other story. And the next
Shut up.
Hey, Dr. Steve, Dr. Scott, Casey.
Hey.
Hello.
How you guys doing?
Good. How are you?
Good.
Good. Doing well, too. Calling with an update from a call I made a few weeks ago about my fitness tracker when I was sleeping, registering this huge spike in heart rate within the first hour or two of sleep. So first of all, I want to give you a bell. If I'm, as the non-host, I'm authorized to do that.
Yeah.
For throwing
No,
I don't authorize it.
Unauthorized.
Sure.
Unauthorized.
I think
Okay, wait a
you
minute.
kind of came
Wait a
up
minute.
with
Okay.
I didn't like
throwing
that
cold
question.
water on an hour or two of sleep. So first of all, I want to give you a bell. If I'm, as the non-host, I'm authorized to do that.
You certainly
for
are.
throwing cold water on my hypothesis that this could be the hypnic jerk. I think you kind of came up with a theory that it might be something called nocturnal arrhythmia. So before following up with my primary care, I did some more research online, and it turns out that this particular model of fitness tracker, won't say the name, but it rhymes with shit slit, is a common known bug that other people were reporting that like right around 1
really?
a.m. in the morning, which is
This was a glitch in the operating
Did he
system.
say shit?
Yeah.
He did.
It's a glitch in the operating system. Can you imagine how many other people were crapping themselves seeing that?
Yeah.
Oh
And
my
how many
God.
cardiac workups were performed?
Oh yeah. Yeah.
Oh my goodness.
That
Okay.
is one of those things where in medicine, like if someone faints and they go to the emergency room, they may end up getting a tilt table test, an MRI, they get all this stuff. It's like, no, you just fainted.
Yeah.
You know? So it's this sort of cascade. So P.A. Lydia is exactly right. I would love to know how many people went to a cardiologist over this.
I'd say a bunch.
Because we were pretty convinced he had nocturnal arrhythmia.
Yep.
That spike was crazy. It's like 90, 90, 90, 90, 90, 150, and then right back down to 90 again. It lasted, 5-10 minutes, something like that. Okay.
Wow.
That's what he said.
shit slit. It's
yeah.
a common known
Shit
bug
slit.
that other people were
That's
reporting
the
that like
best.
right around 1 a.m. in the morning, which is when the time that I was experiencing this, it would, measure this huge spike in heart rate that no one else could explain. And other people suggested that it was doing this even when you weren't wearing the shit slit, the fitness tracker. So I took it off, left it on the nightstand, and sure enough, night after night, it
We're not mentioning any brands or anything, so I'm glad he's masking it so perfectly.
Very
registered
smart
this,
of him.
Yes.
165, 170 heart rate without even being on my wrist. So unless there's, a ghost living with me that's putting it on at night, I think it was bullshit. So that's my update, but it kind of has me thinking of like, what's the benefit of even wearing?
Ooh, I must check my heart rate with this shit flick device.
Anyway.
this thing if it's not producing reliable or accurate data. I mean, I love it for measuring my steps and the distance that I go, but beyond that, is it worth, if it's putting out this stuff that is inaccurate, is it worth wearing? I mean,
that's software. Easy to fix. I think these things actually are, I like the fact that people are paying attention to their sleep cycles.
Yes.
And it's good for me because it tells me you're not getting enough sleep, and I always ignore it. But, if I ever did start to pay attention to it and do something about it, it would be very useful. And I think it's okay. The algorithms they use for things like blood oxygen are not to be relied on, but they'll get you in the ballpark. And they will tell you this is not a medical device, but it can give you a signal that says maybe you should do further testing or whatever. So I still think they're worth having.
Sleep score it gives me seems kind of arbitrary.
And also, if you've ever been on these things, when you start doing exercise, you get these little badges and stuff. People like, "Ooh, I'm only 100 points away from my Explorer badge." It's like, what does that do for you? Nothing, but you have it.
There's
and
something.
Humans kind of like that sort of thing.
Yeah.
Google sucks me in every time. Well, you're only 100 points away from your next level as a local guide. And I start looking for pictures. Did I take a picture at Perkins? Can I get that up there and get an
Mine
extra 100
says
points?
you're only 9,600 steps away from reaching 10,000 steps a day. You can still do it.
11.
Yeah, it's only 7 p.m. You can do it.
Right. That's hilarious.
Now I'm kind of rambling, but I guess my new question is, other than motivating people to get more active, move, if it's tracking their steps, do you guys see that this is a net positive, or is it just more data that's possibly unreliable that is interesting, but people don't really know what to do with?
Yeah, I wonder what they're doing with the aggregate data with this. Is there research that can be gleaned from that?
Sure.
Is there the average heart rate of the normal American going up or down over time?
Activity
That
level.
kind of stuff. Yeah.
I was just reading about Healthy China 2030. I did
Really?
a paper
What's
on cardiovascular disease in China.
Oh, yeah.
And for the prior, I can't remember if it was the prior 19 years. Anyway, the past couple of decades, the rate of cardiovascular disease is just really going up exponentially as their economy improves and have.
You think it's diet or lack of exercise?
Both.
Air quality.
Largely diet driven.
Air quality,
So uncontrolled hypertension, elevated cholesterol with the diet changes.
Really?
So they have this new Healthy China 2030 initiative. But it makes me think about that, right? Certainly a country like China would be able to track.
Yes. And the other thing is that one thing that they can do is, they've got that social score that if you have a social score, like you've said something naughty on the internet, you may get dings to your social score, and then you don't get preferred seats on train things. You can get banned from this and that. This is what I hear. It's I read this in the newspaper. Who knows?
Mm-hmm.
It's hard to. I don't know anybody from there, but I wonder if maintaining your ideal body weight and those kinds of things could become a governmental mandate.
Well, they're starting a huge national push on it. So.
It's a different way of doing things, isn't it? But it's pretty damn effective. All right, here we go.
Hi, Dr. Steve. It's Peppermint Patty.
Hey, Patty.
Hey, Patty.
Wow. Pardon my voice. I've got a cold. Hi, Dr. Scott. Hi, Casey.
Hey, honey.
I have a question on a Patreon show. You had said doctors just you can say to a doctor if you have some object stuck in your rectum that you sat on it.
Right. So, yes. So, patreon.com/weirdmedicine. We had a show where we talked about the fiction that we all have agreed between, it's a contract between our patients and the physicians and other providers that treat them, that if you come in to the emergency room with something stuck up your rear
Million
end,
to one.
just, it's crazy. I just sat on it, and everybody will believe it. Okay. Well, they won't. Nobody will believe it. They will pretend to believe it, so you can save face.
Which made me wonder, well, then how do they get them out?
Because
what I thought of is a lot of lube and a chest opener. Sure, that is not how it's done.
It's not that wrong. And I've seen some that had to go to the operating room because it was too painful to remove, so you have to put somebody under general anesthesia. And if you remember years and years ago, Scott, I think you might have been here, where we played a video of physicians acting badly, and what it was they were taking a peanut butter jar out of somebody's, it was their rectum or their vagina. I can't remember what
Yeah,
it was.
yeah.
And they were all laughing and hooting and hollering, and somebody videotaped it.
Oh
And then,
my
it ended up
God.
on the internet, and it's like, this is not
cool.
No.
cool. So we're supposed to have this compact. Now, that was not in the United States. In the United States, we're very respectful about these things. But one of the things that you have to do is first you just see if you can grab it with tongs and pull it out. And if you can't, it's too painful, you put the patient under, and then you get a speculum, and basically like a vaginal speculum. Have you ever seen a pap smear done? You put it in, it's got two sort of duck bills, and you can open it up so that you can dilate that opening, and you can visualize this thing. And then, yes, you may have to put a lot of lube in there and then coax it out with various different instruments. And if it's something like a light bulb, you absolutely don't want to break it.
Yeah.
So you have to be really careful. But there are, have you ever seen one of those things that you put screw light bulbs in with?
yeah.
It's got little sort of hands,
Yeah, it's
fingers.
a little gripper thing.
Yeah,
yeah.
little grippers.
Yeah.
There are things like that. And so that you can go and just grab that very carefully and just coax it back out again. So, but don't do that. If you're going to stick something, I'm just going to say this. I'm not some namby-pamby, just say no type person. I have to say that frequently. But if you're going to put stuff up your rear end, put something that's designed to put up your rear end.
Yeah.
Plenty of stuff.
Don't improvise.
Yeah, don't.
Yeah.
Just
tell-
go to the store.
Yeah, go to a fun store
Mm-hmm.
and get some lube and do this with a consenting partner. And that way, if something happens, you've got somebody there to help you. But most of the rectal toys will have a lip or like a rocket fin sort of looking shape on it so that it can only go in so far and you can't lose your grip on it and lose it. Because, if you've ever put a suppository up your rear end, it's designed. Yes, it's designed with the pointy end and it's got a blunt end, and you stick it in there and it just loop right up there because there are muscles. The anal sphincter will tighten and then it will actually push that thing up farther into the rectum. That's what people don't understand.
That is a new uh-oh feeling, I would imagine.
Yes. So don't do that.
No.
Go listen to the episode of the Creep Off podcast at creepoffpod.com that's called Concrete Enema, where I talk about a guy that, and we've talked about it a little bit on this show, that gave himself an enema with concrete, which you should not do. Do not do that. It is an exothermic reaction. It cooked him from the inside,
Yeah.
and it was a disaster.
Bad
But
deal.
we talked about it at length on that show.
Yep.
So anyway, all right, everybody. Well, that was a fun one.
Yeah.
That was a good
Goodbye. It's always fun when
Bye,
Lydia's
y'all.
here.
Yes,
Yay.
Lydia rules.
Glad to be here.
All right. Well, listen, check your stupid nuts. Quit smoking, get off your asses, get some exercise. We'll see you in 1 week for the next edition of Weird Medicine. Thanks, everybody. All right. Now we got to do the chicken hormone thing on the podcast because I got that 100% wrong
What?
last time. Yeah. Do you want to start it now?
Sure.
So before we go, well, no, let me do it on a different track here. Hang on. So Dr. Scott, Lydia, and Tacey, before we go, I do want to talk about something we talked about, I think, last time, which was giant chicken breasts.
Yes.
And we were talking about that giant chicken breast we saw on Sam, the cooking guy, that literally looked like it came from a 20-pound turkey.
Great cooking show, by the way.
Yeah, Sam the Cooking Guy is the best cooking show on YouTube, I think. And he says the F word and stuff. He's hilarious. So we were talking about, we thought maybe it was hormones that caused this. It's actually not true. It says a 2015 survey by National Chicken Council revealed 77% of U.S. customers believe farms use steroids. And factory farm chickens grow faster and bigger than they did just 50 years ago. What consumers may not know is the poultry industry, motivated by product, almost exclusively raises chickens who grow so large they can't even walk.
Oh, wow.
So these broilers, those are chickens raised for meat, is one of constant agony. I remember we talked last time.
That's terrible.
You wake up and you're pecking out, you got your egg, and I'm going out into the world, I'm pecking my way out, and it's like, what the fuck is this place? I'm in hell.
Yeah.
I'm in hell. And it's just chicken hell, you know? But anyway, but so I do buy. I buy
Smaller
cage-free,
breasts.
free. No, that's the thing. That's the one time maybe that I would prefer smaller breasts.
I've got oh, go ahead.
Oh, everybody does believe it's antibiotics.
Yep.
Right.
Well,
Antibiotics but actually and steroids.
Steroids,
And
yeah.
hormones were banned.
Hormones, yeah.
In like 1950, and it's really just Mendelian genetics.
Breeding.
It's breeding. It's just you take you got a bunch of chickens. Hey, this one's got bigger tits than the other one does. Let's breed them all together. And you keep breeding them and breeding them and breeding them until they have so much meat on them that they can't walk. They're just miserable.
I did know that because I went to the University of Georgia and we have a great poultry science program.
Oh yeah,
Yeah.
yeah. Really? Did you?
So I've got a friend that's like a chicken farmer guy.
Okay, did you take the class or did you just hang out with your
Well,
friend?
no, I was in that college, so the environmental science college. So my buddy was a poultry science major.
Wow.
So he would have to go out to all the chicken coops and feed them and wash
Yeah.
it.
Now, I've been to some that were definitely not humane. I mean, it was just chickens wall to wall as far as you could see. And they're all pecking each other. And you walk in there and they're pecking you and you smell the ammonia. It's just unbelievable. And you just got to imagine there's fungal and, just fungus and stuff just all over everywhere in their, in their, whatever it is, it's not really feces. It's, they have cloacas, so it's urine and feces together. But, it's just horrible. But then I know there are some places, I've never seen one, where they say, they're free-range chickens, they're cage-free, they run around. I don't know how you run a chicken farm that way.
Now, and cage-free can just mean they're not in individual cages. So they're still in those big buildings,
In those giant
wall
buildings.
to wall, but
Oh,
they're
okay.
cage-free. So
Yeah, I see. So, but free range means that
Outside.
they're outside running around,
Yeah.
acting the fool.
to my understanding.
Okay, I don't know how can you have a place big enough to do that and make as many chickens as we eat in this country. What
Lots of
500 million
chicken wire.
500 million chickens
They're
die
not running very far if
No,
their
they ain't
breasts
running
are
far.
die to supply our Super Bowl requirement for
Really?
chicken wings.
That's
Yeah,
so
it's like 1 billion wings just on Super Bowl.
There was an
These
interesting
chickens
like,
running around without any arms.
psychology to that person that I think about often. Because I said, well, isn't it just so sad? Like you go in there and,
No,
you have these, and he said, they're not animals, they're
Right,
food.
they're just things. They're
Yeah.
things we eat.
We
yeah.
breed them, they grow to maturity in X number of weeks.
Right.
They're not, and I think that was his like coping mechanism because he's a really sweet person. But
Yeah. Yeah, you have to.
It stuck with me.
Well, and that's if you start thinking about it in terms of chicken holocaust, then it's nightmarish. But when you think about it as we eat meat, we have to eat, and we have to. I mean, I know people that think that they hear carrots screaming when you pull them out of the ground. I don't know what they eat.
It's Scott.
Mm-hmm. Probably me. It's me screaming.
He doesn't eat carrots.
I love carrots.
So, I don't know. I mean, that does, if the carrots are screaming when you pull them out of the ground, then it does raise ethical concerns about eating carrots. So you can just take this thing to all kinds of extremes. And so I understand the PETA thing, but I'm still eating chicken and I'm still eating
it's really
whatever.
good.
And liking it.
Maybe we should pay the extra bucks for the.
Well, I do with the eggs. I do that.
definitely do with the eggs.
I feel like
So
I'm
do we.
doing something. I don't know what I'm doing. I don't know if it's just something to make me feel better. And you think about farmed. We worry about overfishing the oceans, but then they say, well, farmed fish is bad. And it's like, well, then what the hell? Can't eat fish either.
Kind of tastes better to me, farmed salmon.
Really?
Yeah, I like farmed salmon.
Do you? Okay. Well.
Or maybe I just haven't,
And
I like the least healthy salmon.
If you eat salmon every day, then you got to get your mercury levels checked. It's just like you can't win. So just eat whatever and do be a nice person in your real life, and
Check your stupid nuts.
Check your stupid nuts for lumps. Quit smoking. Get off your asses and get some exercise. We'll see you in 1 week for the next edition of Weird
Goodbye,
Medicine.
everybody.
Thanks, everybody.
exit.
That's like me yelling, "Move to adjourn" at the beginning of a meeting at work. All right, very good. Thanks.
Good stuff.
All right. Hey, we'll end it that way. I like that.
Good job.
Fucking Lydia. Jesus.
Damn, Lydia.
Taking
Sneaking
over
it.
everything. Let me see what this is.
I didn't even think of it that way.
That was hilarious.
just thought-
Perfect. Perfect timing, too.
It was. Let's see. I'm going to see if this is an old show here that I've got. Hang on. Gotta be. I mean, wait. Okay, that's old. All right, let's do the beginning, and then we'll be done. How about that?
That ate a ball of yarn. Why did the art collector buy an old septic tank? It's filled with mass turd pieces. Did you hear about the contest to win a ton of cow manure? To the victor, go the soils. What did the father buffalo say to his son when he left for college? Bye, son.
If you just read the bio for Dr. Steve, host of Weird Medicine on Sirius XM 103 and made popular by two really comedy shows, Opie and Anthony and Ron and Fez, you would have thought that this guy was a bit of a clown.
Why can't you give me the respect that I'm entitled to?
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valve, exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic echographic and a pulsating shave. I want a magic pill for all my ailments, the health equivalent to Citizen Kane. And if I don't get it now in a tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease, so I'm paging Dr. Steve. Dr. Steve!
From the world-famous Cardiff Electric Network studios, it's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio, now a podcast. I'm Dr. Steve with my little pal, Dr. Scott, the traditional Chinese medicine provider who gives me street cred with the wacko alternative medicine assholes. Hello, Dr. Scott.
Hey, Dr. Steve.
And my partner in all things, Tacey. Hello, Tacey.
Hello.
And we will have Tacey's topic time later. Oh, no, Tacey's time
Potty
of topics.
break.
I got to be careful not to have a copyright violation from Harrison Young. It's Tacey's time of topics. That'll be coming up soon. And then back from sabbatical, Lydia. Hello, PA Lydia.
Hello.
So good to see you. This is a show for people who never listened to a medical show on the radio or the internet. If you have a question you're embarrassed to take to your regular medical provider, if you can't find an answer anywhere else, give us a call at 347-766-4323. That's 347-POOHEAD. Follow us on Twitter at Weird Medicine or at DrScottWM. Visit our website at drsteve.com for podcast, medical news, and stuff you can buy. Most importantly, we are not your medical providers. Take everything here with a grain of salt. Don't act on anything you hear on this show without talking it over with your healthcare provider. Yeah, very good. So, PA Lydia, you still doing what was that thing you were doing? Argo Project or something?
Yeah, Allied Extract.
Allied Extract.
Yeah.
That's very good. So check her out at alliedextract.org.
Yeah.
Oh, very
Thanks,
good.
guys.
Throw them a couple bucks. No matter what side you're on in that conflict, helping out people who need help is always a good thing. Human beings, not politicians.
Human beings.
Check out stuff.drsteve.com for all of your Amazon needs. Our website now is in a state of flux, but stuff.drsteve will still get you there. And check out Dr. Scott's website at simplyherbals.net. We'll talk about it in a minute. And then Tacey, you and I are doing patreon.com/weirdmedicine. And we've got some big guests coming up. And apparently, I've just read rumblings of this. Apparently, Anthony and Kevin Brennan are on the outs again. And so we're going to have to get Kevin in here to talk about what the hell happened there.
Oh, no.
So, yeah, we'll get Kevin in and maybe Anthony as well. Although I'll be seeing Anthony maybe this weekend in Rochester, New York. Check out tickets at WATPlive.com. There's still a few left. No VIP tickets left, but there are some regular tickets left. And then check out cameo.com/weirdmedicine. I'll say fluid to your mama or whatever you want me to say to her. I do not care. Well, there was one where I said, I don't know if I can say this one, but that was one out of the hundreds that I've done. It's dirt cheap. I just do it for fun because it's fun to do. That's it. And all that money goes into my ham radio fund, and my buddy Dale and I are going to we're going to buy a preamp with that money so that we can bounce signals off the moon and talk to other nerds who are doing the same thing. It's kind of cool. Yeah, so use the moon. Look at that look on Tacey's face.
That's really neat.
She just
Don't
looks
encourage him.
like she just ate a chunk of liver, thinking
turd
that
sandwich.
it was, or something. Anyway,
Don't encourage him, Lydia.
You haven't seen anything till you see a kite flying on the beach
with a ham radio
with
antenna
a ham radio antenna attached.
at the beach.
Is that
was
the plan?
fun.
Oh, you did that already?
Yeah, and then they left, and then it started raining. So me and the other wife had to try to put it up. We don't know how to put that shit up.
Yeah, why
it
did
was
we
a
leave it there?
disaster.
I don't
Yeah,
remember that.
I don't know. You just left it. You just
I think
left
we had
it,
to go get something
and then
because we'd forgotten a piece of coax or something,
massive storm comes.
which happens at the beach out of the blue.
Yeah, quickly, huh?
Well, what we were trying to do is, repeat the Ben Franklin experiment, flying the kite. I wonder if he really did that. That has to be apocryphal. I mean, surely he wasn't out there holding the kite. I bet you he had a kite, and then he had a Leyden jar that had the little 2 pieces of foil in it. And as lightning hit nearby, he watched the foil move, and that way he proved that lightning is electrical phenomenon.
Yeah, it was
has
awesome.
to be that. But this picture of this guy standing out there holding a kite on a string, I think that's not how it really worked.
In June of 1752.
What does it say?
It just says he
Does it
was,
say what
he
the
was
mechanism was,
said
what the
to
symbol
have
was?
flown a kite.
There's no way that he just stood out there going, well, I hope it gets hit by lightning. I'm sure he didn't talk like that either. Man.
I mean, every source is saying,
Well, that he flew a kite.
yeah.
But surely...
Franklin's kite was not struck by lightning.
Right.
Okay.
That I
Well,
know.
then
It
he
was-
would have been, yeah.
electrical fields were moving nearby, and that created
The kite picked up the ambient electrical charge.
Yeah.
Yeah.
It's pretty damn cool, though. He was a smart son of a bitch.
Hell yeah. Good stuff.
Got to give him credit for that.
Good stuff.
And apparently he got the most, quality poon in France that there was available at the time. So got to give him some props on that as well. All right.
All right, boys and
All
girls.
right. Oh,
Thought that'd get a reaction out of you, Tacey. Me talking about quality poon. That's so gross. So such a gross way to put it. All right, let's see. Let's get rid of all of the.
Get rid of it.
We've
all.
got one guy.
Hi, Dr. Steve. It's Peppermint Patty.
Hey, Patty. There you go.
We done?
Yep.
I'm
Hey,
leaving
Dr.
this on
Steve,
for
Dr.
you.
Scott, Casey.
Okay. So you can be heard extra.
We got one guy that his pharmacist, listen to this, his doctor wrote him a prescription for, like, say, Xanax, 1 milligram twice a day. And the pharmacist said, no, that's too much. And he reduced the dose on his own. Right. I need you here when we talk about that one, because that one, that's bullshit. Well, they do have prescriptive authority, but can they just change somebody else's prescription, though? Well, maybe that falls under that. Okay, yeah. All right. Are you guys leaving, or are you going to... You two need to talk about your trip.
Yeah, we need to get the fuck out of here.
Okay, bye.
Wow.
Now, don't turn your mic off, Taste, because he'll use it for his mandolin.
I didn't.
Okay, thanks. Oh, keep playing that. Whatever you're playing, keep doing that.
It was a.
All right, we'll keep.
We had a
doing that.
request, and I was seeing if I could play it.
Okay. No. Okay.
Yeah.
You're picking up.
Yeah,
a different...
yeah, I was just getting the acoustics in, which someone sounds better.
Okay. That doesn't sound good.
Well, that's awful. That's what you call a wrong note, brother. You know what it is? It's that stupid fucking thing, man.
What is it?
Yeah, Chris. That was Chris. Wasn't it Chris? No, Clint.
Which Clint?
Clint from Illinois.
Oh, yeah?
He asked us if we'd play Cold Rain and Snow.
What is it?
Which is, of course, is an old Dead song.
Okay.
I just emailed it to you.
Okay.
And it's got lots of room for you to do your thing. I
don't know if I like that.
Because it's 2 chords.
Oh, okay.
It's just about all I have to do is not screw it up.
Well, that's a big
That's
ass.
a big ass, big boy. And a big ass.
You Gmailed
a
it
big
to me?
ass. Yeah, it should be Gmail. Yep.
Well, I've got your.
There should be a link. There should be a link to.
Oh, Cold Rain and Snow. Yeah.
Yes, sir.
Okay.
Let's see if I'm even close to being in tune.
Oh my goodness! It's just D and E.
Yeah, but it's really a great tune. It's a. Okay. You'll love the words. I think Love It even knew what I was playing a second ago.
Me, you,
me.
Leg cramp.
Uh-oh, leg cramp.
Yeah.
That's not good.
Damn it. Hate that. Old man.
It is a booger, ain't it? Well, I buried me a wife. She's been in trouble all
Now you
my
stop?
life. Yeah, here we go. Well, cold rain and snow. Rain and snow. Oh, rain and snow. Left me out in the cold rain and snow. All right, here we go. You ready? Well, I married me a wife. She's been in trouble all of my life. Left me out little tune. Well, I ain't going where the chilly winds don't blow. The winds don't blow. And I'm going where those chilly winds don't blow. Well, I married me a wife. She's been trouble all my life. Ran me out in the cold rain and snow. Rain and snow. Ran me out in the cold rain and snow. Ran me out in the cold rain and snow. Ran me out in the cold rain and snow. Ran me out in the cold rain and snow. Ran me out in the cold rain and snow. Well,
I finally figured out the upper register at the end of this song.
yeah. So you got the deal. Let's do it one more time. It's a shorty. It's a shorty anyway.
Okay.
All right. Now, let's see here. We're gonna do it one more time here, Clint.
Do you want a?
We'll get a little closer than
a
that.
drum track with it?
If you got one.
I might be able to come up with one.
Remove.
Hang on a second.
Kush. We need Kush here to back us up.
Where is Kush?
Kush is there. Cushy. Actually, his name's now Cushy. I think.
What?
Yeah, I love it. Decided we're gonna call him Cushy instead of Kush. He liked it
Why
better.
would
so.
we do that?
I don't know. He said he liked it better too.
He does? He does not.
All right, Clever, we're going to try one more time, buddy. Now that Dr. Steve has got it dialed in. Yeah.
Will that work for you?
Let's see.
Too fast?
Just a hair, yeah. There you go.
Still a little fast. Try that.
Yeah, that'll do it.
No. Yeah, that's all right.
Well, I married me a wife. She's been trouble all of my life. Ran me out in the cold rain and snow. I can't do it with that fucking tracker. I can't. I think I'm off.
You're
think.
not.
Am I on it?
You're on it,
Yeah,
yeah.
okay, I'm sorry. I thought I was off. Yeah. Start one more time, please. I'm sorry. I really thought I was way off it. Well, I married me a wife. She's been in trouble all of my life. Left me out in the cold rain and snow. Rain and snow. Rain and snow. Ran me out in the cold rain and snow. Is that it? Well, she's coming down the stairs, combing back her yellow hair. And I ain't gonna be treated this way. This way. And I ain't gonna be treated this way. Well, she went up to a room where she sang a faithful tune. Well, I'm not gonna chilly winds don't blow. The winds don't blow. And I'm going where those chilly winds don't blow. That was closer.
Closer. We did get a little off that time, but not too bad.
Oh my gosh. Yeah. Hey, listen, guys. That's about the max of my vocal height.
Love me some kombucha.
Love me some kombuchas. Yeah, I know it. Love it. That's about the max of my.
Sean gets that one.
Hopefully they had a little bit of.
Is Amanda in there?
Yeah, Amanda's there. She's been there all day long.
Howdy do.
She's up there in the. Clint, I tell you what, we got it close that second time. Dr. Steve was in the middle of doing some pretty fancy slinging.
If I'd practice,
slinging.
I'd have it. Forgot where the high registered D was, and it's like, okay, well, this is E, so it's going to be 2 frets down, you idiot.
I love that song. Yeah, we can do that a little bit better. I like it. I do love that song. We hey, let's do that. I want to talk to you about.
What's that?
Give me a little bit of.
Give me a C, a bouncy C.
Give me a little bit of amplification on my guitar here.
Oh yeah.
Yeah. Here's an A for you if anybody cares.
Ooh,
I think
what is that?
Clint was playing with it there. This is my
that?
PRS. I got a PRS about a year ago.
Did you bring that today? I've never seen it before.
Yeah, I brought it today. Yeah, that other one, I just couldn't get that up. I just couldn't get yours to hold it.
No, it won't.
No, it won't hold it.
I need to just restring it.
Yeah. Well, we restrung it, but well, shit, it's been 10 years ago, though. You know.
Well, it's a shitty guitar too. I think it's a PV knockoff. That's what. It's not even a PV.
Not even PV. Yeah.
Okay, what's the song I'm looking for?
So we're going for Jerry Jeff Walker.
Yeah.
Trashy Women.
Trashy Women.
You're going to love this. You will love this.
It's what we wish that we had listening to our show.
All right. Clint, nice guilt fiddle.
What did he say?
It's a nice guilt fiddle.
Yep, it's a guilt fiddle. Well, get your guilt fiddle out there, fellas. You can play you one. Play us a little ditty. On the A that long?
It stays on the let me see. Let's get this right.
All right. Let me. Because in my music, it goes back to the.
All right. Remember this peppy, guys. This is our peppy version.
Okay.
Peppy.
All right.
So
you start and I'll figure it out.
Less tone?
No, I'm doing it on my end.
Oh, good. There we go. There you go. Well, I was raised in a sophisticated kind of style, but my taste in music and women drove my hopes half wild. Mom and Dad had a plan for me. It was debutantes and symphonies, but I like my music hot and my women wild. Yeah, I like my women just a tad on the trashy side. When they wear their clothes too tight and their hair is dyed. Too much lipstick and too much rouge gets me excited and a little confused. Hey, I like my women just a tad on the trashy side. Should have seen the looks on the faces of my mom and dad when I showed up to the door of my day for my this ain't no problem. They said, pardon the son, but she ain't no kid. That's a cocktail waitress with a Dolly Parton wig. I said, I know it, Dad. Ain't she cool? That's my kind I dig. Yeah, I like my women just a tad on the trashy side. When they wear their clothes too tight and their hair is dyed. Too much lipstick and too much rouge gets me excited and a little confused. Hey, I like my women just a tad on the trashy side. Keep going. But I like 'em brassy, like 'em brazen in a bowl. They say opposites attract, but I don't agree. I need a woman that's just as tacky as me. Yeah, I like my women just a tad on the trashy side. Hey, I like my women just a tad on the trashy side. When they wear their clothes too tight and then their hair is dyed. Too much lipstick and too much rouge, well, gets me excited and a little confused. Hey, I like my women just a tad on the trashy side. Hey, I like my women just a tad on the trashy side. One more time. I said I like my women just a tad on the trashy side. Ain't that a fun song?
Yeah, that's a good one.
All right. Yeah, Colin, that is a semi-hollow body PRS. Good eye. Good eye, good eye. I don't know if you can see it.
It's almost like a... almost do that as a Louisiana two-step, actually.
Yeah, it's a great. Isn't it a great? I just love the energy of that song, though. And of course, the all right, love it. I hope you enjoyed that.
Patty, that isn't true.
Hey, love it. That was for you. All for you.
Oh, you know what? One's been practicing.
Oh, you know what? I've been listening. Hey, check this out. See if you you've heard this before.
We need to put some. We need to put some pedals on that thing. What is that? Yellow Rose of Texas? Or
No,
something?
well, you're close. Let me see. Let's try it again one more time.
Yeah. Okay. Yeah. I knew a woman who lived in El Paso. Is that it? Something like that. Yeah. That's pretty good.
Out in the West Texas town of El Paso, I fell in love with a Mexican girl. Nighttime would find Eddie Miner Grose's Cantina, a display while the music would swirl. Eyes were as black as the night of the moon. Da 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 da.
Listen, if you would imitate that guy like you just did there, you might have a career in singing. Do that again. Find the fucking
Let me get the
words,
lyrics, yeah.
and then do it as a parody of him. And when you do that, it sounds great.
Give me a.
Is there a chorus to that?
Yeah. So this is Marty. We'll do the Marty Robbins
What's it
covered by
called?
the Dead, called El Paso. Okay. El Paso, yeah, in D.
You You could tune that
flat.
one note up a little
Yeah,
bit.
something's flat. Hang on. Sorry.
We doing the Marty Robbins version? So we're doing the
Grateful Dead, yeah. Of course.
The Grateful Dead version, okay.
It's pretty much the same. Yeah, my D was flat. No, I mean my A was flat. There we go. So he kicks it off with a yep. Yeah. There you go. There you go. Out in the West Texas town of El Paso, I fell in love with a Mexican girl. Nighttime would find me at Rose's Cantina. Music would play and Felina would whirl. Black as her eyes, the eyes of Felina, wicked and evil while casting a spell. My love was strong for this Mexican maiden. I was in love, but in vain I could tell. Oh shit. One night a wild young cowboy came in, wild as the West Texas wind.
Gotta learn to yodel.
I'll get there. Dashing and daring, a drink he was sharing with wicked Felina, the girl that I love. So in anger I challenged the right for the love of this maiden. Down with his hand for the gun that he wore. My challenge was answered in less than a heartbeat. The handsome young stranger lay dead on the floor.
Did Felina like you after that?
Just for a moment I stood there in silence, shocked by the foul evil deed that I done. Many young thoughts. Oh shit! Many young thoughts ran through my head. Stood there. I had but one chance, and that was to run. Damn. Out through the back door of Rose I ran. Out where the wild horses were tied. There you go. I picked a good one, he looked like he could run. Up on his back and away I did run. Just as fast as I could from the West Texas town of El Paso, out through the badlands of New Mexico. Back in El Paso, my life would be worthless. Everything's gone and nothing is left. It's been so long since I've seen the young maiden. My love for her is stronger than my fear for death. I saddled up and away I did go, riding along in the dark. You're supposed to help me with that.
Sorry.
Maybe tomorrow a bullet may find me. Tonight nothing's worse than this pain in my heart. And at last here I am, there on West Texas, down of El Paso. I can see Rose's Cantina below. My love is as strong as it pushes me forward. Down off the hill to Felina I go. Off to my right I see 5 other cowboys. Off to my left I see 12 more. Shouting and shooting, I can't let them catch me. I've got to make it to Rose's back door. Something is dreadfully wrong, for I feel a deep burning pain in my soul. There you go. It's getting harder to stay in the saddle. I'm getting weary and rail to ride. But my love for Felina's strong. So I rise where I've fallen. Though I am weary, I can't stop to rest. I see the white puff of smoke from a rifle. I feel the bullet go deep in my chest.
Oh, shit.
Oh, yeah, it gets worse. From out of nowhere, Felina has found me, kissing my cheek as she kneels by my side. Cradled by two loving arms that I'll die for. One last kiss and Felina, goodbye.
So I messed up in the middle because I got caught up in the story. So wait a minute. So he goes away.
Yep.
And then he comes back a
Yes.
million years later looking for this chick.
Looking for
hoping
Felina.
she'll still be there.
Yep. And he gets shot in the chest.
Who shot him, though? Who were those guys?
The
Who shot
mounted cowboys. They're probably some homeboys.
Oh, they're still after
the
the
handsome
guy?
young
After
stranger
all
was
these-
looking for him.
How long was he gone?
I don't know.
Not
It wasn't
long enough.
Not long enough, obviously.
I got all caught up in the story. I was like, what's going to happen next? And I forgot where I was.
All right, boys.
No,
and
we
girls.
have got to do that
that's
song.
a-
That's a great fucking song right there.
Booze and maidens, yep, big irons and always in trouble. You're right, CC. All right, boys and girls.
Dumbass.
Yeah,
Should've
Clint,
just-
they definitely needed some reverb.
What, you didn't have reverb? Yeah, you had
Yeah, no, yeah, Clint didn't get her.
Yeah.
Yeah, man, you should be,
nowhere, Felina. I can't do that. You did great.
you should be concerned if your niece liked the song about trashy women, Amanda. I guarantee it.
Yeah, agreed.
All right, guys. I hope that wasn't too awful bad, but I love this song.
That's a good one.
That's a
Why
good
have we never done that?
I just thought about playing it the other day. It was I heard the Dead covered it, and I thought, well, shoot.
Oh, they did?
Yeah, and it's actually pretty good. So, but I love Marty Robbins' voice, the way he has a big yearning.
Yep.
Oh my gosh, it's beautiful.
Yep.
Guys, we can't. thank
You got to
enough.
ask, who the fuck is singing the song, though, if he's dead?
I don't
He's
know.
singing it from beyond the grave.
Beyond the grave,
It should be,
like a miracle.
out in the West Texas town of El Paso.
The ghost
from beyond the grave.
The ghost of Felina's lover.
Yes.
Felina's lover.
So ridiculous.
Guys, we appreciate y'all. Hopefully it wasn't
Yeah, it was
too
fun.
terrible bad. It sure was a lot of fun.
We will
Lot
not be
of
doing
fun.
this next Saturday because
Dr. Steve's gonna be
I
gone.
presumably am going. There's a chance I might not be able to go.
Oh man,
But
that'd be no good.
it's looking better. So I'm assuming I'll see you all in Rochester, New York.
Colin, CC, Sean.
But we will be doing another show. Can we do a show Wednesday? Do you think?
Yeah.
We could.
Yeah, if you're gonna leave
Do it
Saturday,
late?
we'll do Saturday. No, Wednesday anytime.
We might do one Wednesday.
Yep.
All right.
Just let us know. We'll let you know if Dr. Steve's going out of town. We'll try to do on Wednesday at 4-ish, 5-ish. It doesn't matter to me, honestly. It doesn't matter. 5 is good. You want to call it 5 and so you don't have to rush?
What?
You want to say Wednesday at 5?
The later the better. Can we do 6?
6 is fine. I just don't want you to rush here.
Well, no, I don't want to mess your night up.
No, I don't care. It's all
You
good.
sure?
Yeah.
Okay. Well, we'll say 6, and if I can get out earlier than that, we'll do it.
We'll let you guys know. But thank you all so much. I hope those songs weren't too terrible.
No, we do them because they're terrible.
Have a great.
If we start having the expectation we're going to do a good job, then we're ruining it.
Yes, we are. Oh, I know what I was going to
Merlin Goods. What's Merlin Goods?
That's top secret.
That's
That's top
it's on your. It's in your.
No, it's not top secret. It's coming. It's coming.
Okay.
It's coming. It's coming. It's coming. You will know when it's time.
All right.
My brother.
Well, at least something's coming.
Yeah, something's coming. It ain't you. Hey,
It
check
ain't
this
me.
out. Check this out. You got any? Give me.
Ooh, we could do.
Give me a little.
It
Volume.
ain't me, babe. Whoa,
Yeah, we could do.
whoa.
Give me a little volume.
Yeah, you got some. Yeah. Oh, well, I know what that is. Were you gonna do it?
If everybody's gone, I'll do it. If everybody's gone.
Yeah, everybody's gone. There's nobody there.
If everybody's gone, I'll do it.
So, hang on. Let me find it.
And then I'm going to take my puppies up on the mountain. You know, we've been going up there and doing 4 and 5 miles every Saturday.
Really?
Oh, my God, it's wonderful.
Oh, I would like to do that.
It's wonderful.
Do you have to keep them on the leash?
Oh, yeah.
Oh, okay.
Well, Sugaree is I put her leash through Stella's leash, and Sugaree pulls us up the hill. I tell her pull, and she pulls. I mean, literally, we just kind of just follow around. It's pretty hilarious. Now, this is not for broadcast. We'll see just how it sounds. Okay, we'll see how it sounds. It's
a little out of tune. So let me.
Me.
You are, yeah, one of those.
Yeah, you know what I think it was. Again, it was weird. It was like that.
I'm gonna give you
A was out.
I'm gonna give you a little compression.
Yeah, give me a lot of
I'm gonna
compression.
Take off some of this.
A lot of compression. It was the A was flat again. I think it's pretty close. The worst part of the snow is the very first one. Crossroads.
Oh wait! I took the reverb off.
Crossroads seem to come and go. Yeah, gypsy flies from coast to coast, knowing many love and none.
Oh, sorry. Okay, I forgot.
Bury sorrow, having fun. But back home he'll always run to sweet Melissa. Freight train, each car looks the same, all the same. No one knows the gypsy's name. No one hears his lonely sigh. There are no blankets where he lies. In his dreams, the gypsy flies to be the sweet Melissa.
Well, I forgot this song.
Go on the chorus.
Again the morning's come, again he's on the run. Sunbeam shining through his hair, appearing not to have a care. Pick up your gear and gypsy roll on. Missed it. Roll. Crossroads, we have been let him go. Lord, Lord, where you hide dead man's go. I know he won't stay without Melissa. But I know he won't stay without Melissa.
Now I remember the song. I picked it up on the last verse. So
Yeah, I butchered the middle of the thing. Yeah, I just can't. I've got to be real careful where I go with that one note because it just ruins the piss out of it. So we'll practice that. That sound good? We'll record it next time. It's that right there. I've just got to be careful with it.
Then it goes, wait a minute.
The C sharp minor.
Then it goes to the C sharp minor.
Well, pick up your gear and gypsies roll the sweet Melissa.
Okay, so let's just try the verse.
You only go chorus or verse?
Let's do the verse first.
Okay. Let's go to the
I
second
wanna get
verse.
that.
Yeah. So we're going to go to the second verse, okay? There you go.
All right, you ready?
Yeah. So let's just go to the second verse. So.
Second verse? Okay,
Yeah.
and then to the chorus. Okay, yeah.
So.
Freight train, each car looks the same, but all the same, no one knows Gypsy's name. No one hears his lonely sighs. There are no blankets where he lies. In his dreams, the gypsy flies with sweet Melissa. Again, the morning's come. Again, he's on the run. Sunbeam shining through his hair, appearing not to have a care. Pick up your gear and gypsy roll on. Roll on. Crossroads, we ever let him go. Lord, will you hide the dead man's gold? Or will he lie beneath the trail? Or will the spirit float away? But I know you won't stay without Melissa. And this goes right to F sharp minor, yeah. And then right back to the C sharp minor. Yes, I know he won't stay without Melissa. It's supposed to, you gotta have that.
Anyway, okay. Well, I'm glad you got over your phobia of Melissa.
Oh God, it's still not good. But it's
We should play the old one and then play it
Lord,
now.
no.
If you try to do it as Marty Robbins, it'll be awesome.
Oh, no one might do that. That's fun. That's good though. That's
All right.
fun.
Thanks everybody. That was fun.
Oh shit! I hope no one's listening to that.
There's Kish.
Kush, what's up, Cushy? Semi-signal exactly, Sean. Yeah, Sean, believe me, I can do better, and I'm practicing it. I'm actually practicing, literally, which is against my religion. Corndiff. I didn't see you earlier. Y'all take care. I will nail that song before tonight. Nail it.
I gave up ever playing it ever again.
It's a relative thing. Yeah, I was playing the other night on the guitar and I thought, I just want to. Hell, I'll just sing it. You guys be good.
So I'll practice that. I don't think Semi-Sweet Melissa is on the internet anywhere.
No.
I
hope it's been taken down.
It is, yeah. But I have it on the thumb drive, so if anybody buys the access to the thumb drive.
You gotta keep it, because if you don't know where you've been, you don't know where you're going. If you were terrible, we give you something to shoot for. Being less terrible.
Yeah, that's right.
I don't mind listening to it.
Well, here it is. It was episode 204, and the reason is that
you're listening to Weird Medicine with Doc.
Me too. Check because there's an outside to him.
Oh, sorry.
Verb.
I want to listen to the bass part because I've actually played this song pretty well.
So that's G-Vac on guitar, your old pal Dr. Steve on bass.
Am I loud enough?
Yeah, I think so.
Good. All right.
Fucking G.
And I'll be nowhere near tune.
Yeah.
Crossroads seem to come and go.
Now, what people don't understand that haven't been around since episode 200 is that Scott had never sung before, ever sung. He wanted to.
Knowing many, loving none, bearing sorrow, having fun.
This is the original, yeah.
Look back home,
It was
always wrong.
episode 200. We're on episode 5 something. No, it's not today. No. At least you can laugh about it now. God, G-Back was so just smooth. I was gonna say, yeah, that sounds pretty good.
Each comes the same, all the same.
You went one stanza too early.
Yeah, one too early.
Because he changed the lyric time. That's why I was trying to catch up to him.
Oh.
Do it again.
Not really. I didn't have it in track.
No. Bring it around. Bring it home.
Stereo.
Now,
mix,
free.
yeah. That'd be nice. I love this playing, yeah.
Each comes the same,
And we fucked it up, too, because
all the same.
he was trying to catch up with the lyrics.
No one knows a gypsy's name, and no one hears his lonely sigh.
Listen to the difference between you then and now.
There are no blankets where he lies. Lord, is the deepest dreams of gypsy fly, sweet Melissa.
You had the right idea.
Oh my God.
Let's see if we get a copyright strike on that, then you'll know you at least did. Yeah. Oh, here comes the chorus. Oh, no. Oh, did we even do the chorus that time? We didn't even do the chorus.
Don't know where I lost you.
That's all right. Who gives a shit?
Sorry, G.
No, it's okay.
All right.
Is he our opening act?
Hell no.
Who was that?
We really could do some later.
Oh, that was Diane?
Dylan with him with that fucking voice.
Yeah.
You know?
Yeah.
Well,
That's actually pretty good. That's hilarious.
Yeah.
Hearing him laugh about that.
Yeah.
what's that one that sounded just sounded just like that?
I think Tom Waits' voice.
Yeah,
was the
Tom
best.
Waits better. Mm-hmm.
Oh wait, we're still recording, dude.
Oh, oops.
Oh, we are.
Oh,
Tom
Yeah,
Waits.
we're still-
Oh,
thanks, folks.
I think you faded out after the song and we were done.
Oh jeez.
I love it.
Yeah, that's funny. All right, blast from the past. Thanks, everybody. We'll see you next time.
Oh my God! I thought was that
Thank you.